Hey everyone, I thought I would make a quick video on scrotal slings. I end up getting a lot of questions about this, so this is kind of my quick fix of if you need a quick scrotal sling in the moment, particularly in acute care. So how this kind of came about, I was in the supply closet getting supplies for another patient, and one of my PT coworkers came in and was telling me about a patient that she couldn't get up because they had so much scrotal swelling. It was just really painful for them to be up and moving while the scrotum was in that dependent position. So I grabbed some things that are in most supply closets and we kind of crafted something up, and that patient was able to get up. So it's kind of a trick I've been using if you either don't have time to order a scrotal sling, maybe through your hospital system, or the scrotal slings that they have tend to not be the right size, or at least that's what I've found in the past. So this will work in the meantime. So what I use is just your standard like hospital brief underwear. You can also use this one's mesh, but you can use the one that's like more solid. And then ace wrap. Sometimes I've used a safety pin, and we kind of incorporate the gate belt sometimes. Just kind of depends on what you're trying to do with it. But the main concept, I'm going to use this balloon here to kind of demonstrate my scrotum. So with the underwear, I slip the scrotum kind of into one side, or like one, what would be leg if you were wearing it as underwear. And then I use that to kind of hold everything up. I like the underwear because it already has a hole. So they can either have a hole to urinate, or if there's like a catheter coming out, then you have a place for that to go. And then I have the other leg free, and I usually just kind of twist this around so I can hold everything into place. And this creates a nice loop. And with this loop, I will either take my ace wrap and kind of wrap it through the loop and like hold it up, wrap it around the patient's waist to keep it in place, or I've just stuck the whole loop through a gate belt, or I've done the ace wrap, looped it back around, held that up through a gate belt. I've even not used the ace wrap and just taken this loop and a big safety pin and safety pinned it to their gown or somewhere higher up, just to kind of hold everything up and in place. I've had really good success with patients reporting less pain when the scrotum is just being held up. I don't use this as like, necessarily something they're going to do all the time. This is just kind of our quick fix for a task in the moment. And then if it's successful, then I might work on either making them some sort of scrotal sling. I worked with a therapist who, when I was a student, who would sew them and kind of taught me her technique from that. And we used an old t-shirt and some splinting materials. Or worked with my lymphedema therapist who have made something custom for that specifically. So that's my scrotal sling. I'm also going to post an article I found that goes over some more specific scrotal edema treatment ideas and techniques to use with patients. I thought that it had some really good points. One thing I always make sure I go over, even if I'm just doing this quick fix, is positioning and making sure that they're not sitting on things, and how to position things up with towels or washcloths or whatever works for them, that we kind of try to get everything positioned before I leave the room. So let us know if you have any questions, and I will post that article in the comments as well.